As of January 13, 2021, 537 children have tested positive for COVID-19. The age distribution of reported COVID-19 cases was provided by the Minister of Health, Dr. Frank Anthony, on Wednesday during the daily COVID-19 update.
The only reason why we have detected that there are children who are positive is because when we go to do contact tracing in a household, when you go into that household, there might be children in the household, and we would test everybody in the household if we believe that they would have been exposed to someone who's positive.
Minister Anthony revealed that the children, who are all between 0 to 14 years old, have contracted the disease since the emergence of the virus back in March 2020.
From 0 to 5, we have 114 children who have tested positive over the duration since we have started. And between the ages of 5 to 9, we have 176 children. And between the ages of 10 to 14, we have 247 children.
Thankfully, it appears that severe illness due to COVID-19 is rare among children.
Most of them were asymptomatic, and they were monitored at home, and basically they have recovered.
However, prospects of children being vaccinated against the virus looks grim, as the first phase of local vaccination against the disease only caters for persons 16 years and older. Pfizer recently announced that it received FDA approval to enroll children as young as 12 years old in its COVID-19 vaccine trial. The expansion is aimed at understanding whether the vaccine would be safe and effective for adolescents.
Because there isn't any data, that is why it's not allowed for children to be vaccinated at this time. And of course, the 12 to 5 age group, that trial is yet to be started. I think they will be starting that sometime in April.
Since the reopening of schools on November 9th last year, it is estimated that at least 77 students of dormitory schools have tested positive for the virus. However, since only students of grades 9, 10, and 11 return to the classrooms, many of whom are over 14 years of age, the students' data were most likely not included in the 500-plus positive cases of children announced by the minister on Wednesday. Meanwhile, the morbidity rate remains low in children. It currently stands at 2. Back on November 6, an 11-year-old asymptomatic COVID-19 cancer patient died at the Georgetown Public Hospital Corporation, GPHC. Later that month, Guyana and the Caribbean recorded its youngest ever death from the coronavirus, COVID-19, after a 6-day-old baby succumbed. The infant reportedly had a heart condition. For the HGP Nightly News, Amel Griffith.